Hey YouTube, welcome to our platform, Nursing Dynamics. So today we're going to talk about basically the difference between degree and license. So Dr. Ray is here with me today, and she's going to talk about the license component, and I'm going to talk about the degree component. And I'm going to go first, and then after that, I will turn it over to her. So when it comes to what we have discovered on our actual platform on TikTok is that um, people who even are credentialed as nurses, registered nurses, LPNs, 2 year, 4 year, doesn't matter. Even advanced practice do not know that there's a difference between having a degree versus a license. So let's tackle the degree first. So when we go to nursing school, whether you are but I will not tackle LPN because LPN is not actually a degree. So I will not say that, but for your starting with your 2 year RN and your 4 year RN, so your ADN and your BSN programs, those are degrees. So once you graduate from said programs, you're a degree holder because you have met all the qualifications that school has set aside to say you meet the criteria for your state board of nursing to say you have met the criteria to hold a degree in as a BSN prepared nurse graduate. That's all that means. You are not a registered nurse at that point in time. So when I have my BSN or my ADN, I have that degree because the institution gave it to me. It's kind of like I have met all the criteria. So therefore, once you meet the criteria, your program will send this information with your transcripts to the Board of Nursing. When they send it to the Board of Nursing, the Board of Nursing verifies all this information to see if you are eligible to take the board to get your license. And that's where Dr. Ray will take over.
Very well explained, Dr. Paisley. So now we're going to get into the license portion. Okay, we're going to start off with an RN license, and much of what I'm going to say is going to also be applicable to the LPN license as well. But I'm just going to say RN just for the sake of the video. So your RN registered nurse is a license. It is not a degree. It is not something you earn while you are in college/university. You earn your license when you sit for the NCLEX exam, speaking about registered nurse license, LPN license. Once you have met the criteria, as Dr. Pace Newburn has just mentioned, you sit and you pass your boards, then you have earned a license and you can practice as a nurse. Even if you have an ADN, a BSN degree, you can have an MSN degree and not have a nursing license. They are not the same thing. These are two separate things, okay? You can't practice as a nurse without your license. It's illegal. You could go to jail and have other consequences. Moreover, if something catastrophic were to happen, you could lose your license, but you would have your degree. So you couldn't practice as a nurse, but perhaps you could do something else with that degree. And I'm going to take it one step further because I am an APRN. For those of you who may be considering one of the many APRN roles of specialty, keep in mind that the additional credentials you get as an APRN is a certification. So what that means is, as an APRN, you're going to have several components. You're going to have a degree. You have a license as a registered nurse, which must be in good standing in order for you to sit for board to even earn the APRN certificate. Certification, I'm sorry. And then you sit for boards and you can earn your APRN certification. And there are several out there. There's family, there's adult general, there's P, there's CRNA, on and on and on. But before you do that, you have to have your degree. And for advanced practice, most are master's prepared nurses. Some programs where you go straight through, you have a doctorate, but whatever that degree portion is, it depends on your program. Then you have your registered nurse license. You have to have that first. Then you can sit for your boards for your APRN certification, whichever one that may happen to be. And yes, there's an additional fee you have to pay. There's another test. It's not called the NCLEX, but it's a test similar to the NCLEX in terms of questions and critical thinking and things like that. And depending on which certification board you're sitting for, of course, the test will vary greatly. But to give you an idea, that's the type of setup that it is. So you're going to take an exam, much like you would the NCLEX, computerized, answer a bunch of questions, go through the scenarios, and earn your certification. Those are typically renewed every 5 years on the certification level. Now, your state board may have you renew it with them with your license every so many years. So how that's renewed just depends on your location, but your location where you practice. But just understand the basics that you have a degree, you have registered nurse license. If you're APRN, you have the APRN certification. Just depending on what that is.
So so what do you think? My question is, what do you think is the biggest hangup that people, I feel like people haven't learned this in school because it's not per se taught unless you had a special instructor who just taught it. But what do you think is the biggest hangup in terms of people don't understand the concept? We actually, you brought this topic up on TikTok, and what was the feedback that you kind of got on TikTok in terms of like, were people like, oh wow, I didn't know that, thanks? Or what kind of feedback did you get when you broke this whole thing down? Because this is actually your topic that you did on TikTok. So what was your feedback?
The feedback I got was actually two extremes. The one extreme was, oh my gosh, you didn't know that. Like, who doesn't know that? And the other extreme was, oh my goodness, I didn't know that. So there's obviously a gap there. Now, if you are not a nurse and maybe you're considering going to school for nursing, or maybe you're just starting nursing school, I can totally understand why you might not, why you might not understand that whole process. However, when I saw people practicing as current nurses, registered nurses with a ADN or BSN, and they didn't understand the difference, that's where I kind of got confused. But also understanding that perhaps, it wasn't clicking, because if you're already a nurse, then especially I'm going to say a newer nurse, because we're not talking about back in the day we had diploma nurses. We just gonna come, we're gonna bring a little bit more recent than that, last 20 years or so. And where most of the nurses have either a 2-year degree or 4-year degree. And I'm thinking, don't you remember sitting for your NCLEX? And the graduation was separate. So I'm not sure where the disconnect is. For me, maybe it was a little different. I was actually, for my undergrad degree, I was a December graduate. So I graduated in December, but we didn't actually have the ceremony until May or June. So in December, I finished, I earned all my credits. My degree was, I think they call it converted, or, whatever the official word was. Yeah, they did all that. And I sat for my NCLEX board that February. So my actual graduation, walk across the stage, take the photos, wasn't until May or June, or whenever that was. So it was very clear to me it was a totally different process, because by the time I walked across the stage, I was already practicing as a registered nurse. I'd already had my first 2 jobs and was already working. So I was very clear on this was a degree versus my license. Not to mention, when you finish your program, they should be telling you things about how to sit for boards. This is the paperwork you need. You have to submit X, Y, Z. Most of them will even recommend review courses. So I think maybe sometimes we get caught up in the excitement of just finishing, because most programs are really tough. People have a hard time. And maybe they get caught up in the excitement of finishing, and they just rush to, the next step without really thinking that it's 2 separate things. And a point that you made, Dr. Pace, was when you said sometimes you'll see the graduates and they'll have RN on their cap, but they haven't set for boards yet. So what it should say is future RN, or I hope to be an RN. Because unless maybe you had a situation that I had where you graduated in December, or sometime, a good portion before the actual ceremony, and then you've already taken your board, passed your board, then you can truly put that on your cap and it be real advertising, because otherwise it's false advertising.
Right. And technically illegal.
Yeah. Because you're
Technically,
not
I mean,
supposed to pose as a medical provider if you don't have those credentials.
right. And that's a big deal. Like it was to the point where at the graduation, the students were instructed, like truly instructed, that you cannot put that. You will be asked to remove your cap if you put that on your cap, because you're not licensed to even say that you're a registered nurse. So I mean, that's how serious it is. So people who don't think it's just the cap, it's not a big deal. I mean, in terms of graduation, what you think, it is what it is. But technically, that's illegal, because you're saying that you're a medical professional, that you have this level of expertise, that you are licensed, you're considered competent and minimally safe. And that has not been determined yet if you have not taken those state boards. And that's what determines whether you're considered to be minimally safe or not. So thank you for, us talking about this topic, because I think a lot of these little things that people like, oh, I know, like you said, people know it, some people don't know it. There's things that I didn't even know, because again, this is not something that's going to be on your state boards in terms of NCLEX questioning to know, what is, and if you didn't have the educators in place to teach you, you're just not going to know. So we are going to finish this video right here, and just, thank you all for watching this video. We want to direct you to our TikTok page, which is at Nursing Dynamics, as well as our Instagram page, same handle, at Nursing Dynamics. Also, if you look in the banner, you're going to see the Amazon store for an icon, where if you want to know where you can get items that we have vetted to say that these are items that we believe in, and tried and true. And what kind of NCLEX book do you recommend? What do you recommend for the next gen? What do you recommend for the X, Y, and Z? We have some of those items located under Nursing Essentials on the Amazon storefront. Feel free to go there and browse and purchase through the storefront if you so choose. We'd appreciate it. If not, it's perfectly understandable. But that is it for this video. Until the next time, you all take care.
Thank
Bye.
you. Bye.